Have you ever walked into the bathroom and felt your heart pounding just a little harder than usual? Not after running, not after stress, just after using the toilet? Hi, I'm Dr. John Maxwell, and after nearly 4 decades of caring for older adults, especially women in their 60s, 70s, and beyond, I've discovered something most doctors don't talk about. Some of the smallest, most innocent bathroom habits, things you do every day without even thinking, could be quietly spiking your blood pressure. And the scariest part? You won't feel it happening. There's no alarm bell, no sharp pain, just a subtle shift. Until one day, it adds up to something serious. One of my longtime patients, Marianne, age 74, told me, "Doc, my numbers are great when I'm in bed, but every morning after going to the bathroom, boom, it's like my pressure shoots up out of nowhere." That comment, it led me down a path. I started observing more, asking deeper questions. And what I uncovered shocked even my nursing staff. There are 8 common bathroom habits most senior women do daily that can quietly and visibly raise your blood pressure, sometimes pushing it into the danger zone, even when you think you're just fine. So if you've ever held in your urine too long, rushed to get up off the toilet, or even just looked in the mirror and thought, "I should be healthier by now," then this video could be a wake-up call and a path forward. Because blood pressure doesn't just rise from salt or stress, sometimes it starts in the most unexpected place, right inside your bathroom. Let's walk through these 8 hidden habits, and I promise, habit number 6 left even my senior care nurses speechless. Let's start with the first one. 1. Holding in urine too long. Let me ask you something. Have you ever caught yourself saying, "I'll go to the bathroom later, I just need to finish this one thing"? Or maybe you wake up needing to go, but you lie there, waiting until it really feels urgent. If that sounds familiar, please don't feel bad. Most senior women do this. It seems harmless, convenient even, but inside your body, something very different is happening. When you hold in urine for too long, here's what your body goes through. Your bladder fills, stretches, and signals your nervous system to empty it. But when you ignore it, the signal keeps firing. That delayed emptying triggers a sympathetic response, your fight-or-flight system, which means your heart rate goes up and your blood vessels constrict. That equals one thing, a spike in blood pressure. And here's the consequence many never hear about. Over time, holding it in regularly can actually train your body to misfire signals. Your bladder gets confused, your kidneys start working harder, and your blood pressure, it gets stuck in a cycle of quiet elevation. Here's the analogy I give my patients. It's like letting a tea kettle boil dry. At first it just whistles, but if you keep ignoring it, eventually the whole pot starts burning. The fix is simple and it's free. Feature: go when you first feel the urge. Advantage: you calm your nervous system. Benefit: and you help regulate your blood pressure naturally. Even better, you reduce your risk of urinary tract infections, kidney stress, and accidental leakage over time. So next time nature calls, don't delay. Answer early and protect your pressure. Now, what about something most folks are too embarrassed to admit? Let's talk about what happens when we strain during a bowel movement. 2. Straining during bowel movements. Let's face it, nobody wants to talk about this one, but if you've ever sat on the toilet, clenched your teeth, gripped the sink or wall, and pushed harder than you probably should have, then this might be one of the most important habits to look at. You may think straining is just a part of aging, that things slow down and you've just got to push a little. But here's the truth. That moment of strain could be sending your blood pressure skyrocketing. Let me tell you about one of my patients, Shirley, age 79. A lovely woman, proud, private. She came in after nearly fainting in the bathroom. We ran her numbers. Her blood pressure had surged 30 points in seconds. Not from exercise, not from stress, just from pushing too hard during a bowel movement. Why? Because every time you bear down, you're creating what's called a Valsalva maneuver. It's the same pressure your body uses when lifting something heavy or coughing hard. And inside your chest, that pressure squeezes your blood vessels, tightens your arteries, and sends your heart racing to keep up. Here's the part most people don't realize. If you've ever grunted or clenched, your blood vessels felt it, and your blood pressure responded immediately. It gets stuck in a cycle of quiet elevation. It's not just discomfort, it's a cardiovascular event. Repeated strain can lead to blood pressure spikes, fainting or dizziness, even increased risk of stroke or aneurysm in vulnerable seniors. So what can you do instead? Hydrate regularly throughout the day. Add natural fiber like prunes, flaxseed, or warm oatmeal. And if needed, use a stool under your feet to simulate a squatting position. Yes, it really works. Newbie, the way you breathe matters. Exhale slowly instead of holding your breath when pushing. That one change can relieve pressure on your heart and brain. This isn't about embarrassment. It's about safety and dignity. Now, let's talk about something colder and far more unexpected. What happens when your bathroom is chilly? 3. Using the toilet in a cold bathroom. Let me paint a picture for you. It's early morning. You've just woken up. The house is quiet, maybe even a little drafty. You step into the bathroom, and that first touch of cold tile on your bare feet makes you shiver. You sit on the toilet, and suddenly, without warning, your heart feels like it's thumping a bit faster. Sound familiar? Most seniors don't think twice about the temperature in their bathroom. After all, we're only in there for a few minutes, right? But that sharp drop in temperature, especially on bare skin, can do more than just make you uncomfortable. Cold exposure, especially first thing in the morning, triggers a vascular response. Your blood vessels constrict to preserve body heat. Let me paint a picture for you. And when that happens, your blood pressure rises, sometimes dramatically. It's your body's survival mechanism. But for older adults, especially those with hypertension, that reaction can be dangerous. Even a few degrees difference in room temperature can spike blood pressure enough to cause, plus dizziness, early morning headaches, or worse, a bathroom fall or fainting episode. One of my patients, Donita, age 82, told me she once blacked out after her morning bathroom trip. The culprit? A space heater that broke during winter. She didn't realize the cold room was triggering her pressure until it was too late. Here's the easy fix. Keep a small bathroom-safe heater set to low. Wear thick slippers or socks first thing in the morning. Use a robe or blanket for that walk down the hall. These tiny adjustments can mean a big difference, not just in comfort, but in cardiovascular stability. Think of it this way. Cold air isn't just uncomfortable, it can be a silent stress test on your heart. And next, we'll explore another daily habit that almost no one questions. What happens to your blood pressure when you get up too fast from the toilet? You might be surprised how quickly your body reacts. 4. Getting up too fast from the toilet. What if I told you the most dangerous moment in your bathroom routine isn't when you sit down, it's the moment you stand up? Imagine this. You've finished using the toilet. You place your hands on the sink or grab the edge of the counter. You push up quickly, and suddenly, the room tilts. Your knees feel weak. Your vision flickers. Your heart skips a beat. One moment you're standing. The next, your blood pressure drops, and your body's trying to catch up. Let's break down what's really happening. When you're seated, especially for a few minutes, your blood pools slightly in the lower part of your body. It's perfectly normal. But when you stand up too fast, your body needs to quickly shift that blood upward to your brain, your eyes, your heart. And in seniors, especially women over 60, those pressure shifts don't always happen fast enough. This is called orthostatic hypotension, and it's more common than most people think. Here's the cause-effect loop. Cause: sudden standing. Effect: drop in systolic pressure, sometimes 20 to 30 points. Result: lightheadedness, blurred vision, unsteadiness. And if you're already dehydrated, on BP meds, or recovering from sleep, that reaction can be even stronger. Let me tell you about June. She was 76, active, independent, and proud. One morning, she stood up too quickly after using the bathroom. Her knees gave out. She hit the tile floor, fractured her wrist, and bruised her hip. It wasn't a heart attack. It wasn't a stroke. It was a simple change in position at the wrong moment. So what can you do? Here's what I teach my patients. Pause before standing. Sit for an extra 10 seconds. Take a deep breath and plant your feet firmly. Use the counter or a grab bar for support, not momentum. Drink a glass of water first thing in the morning to prep your pressure. Because sometimes the most life-changing advice is this simple. Rise slowly. Protect your balance. Don't let blood pressure catch you off guard. Now, let's shift from body movement to something you'd never expect to affect your pressure, your cleaning products. And this one might surprise you. 5. Using scented or harsh cleaning products. Now let me ask you this. When you walk into your bathroom and it smells like lavender pine or spring breeze, do you ever feel proud? Like, it's clean, fresh, safe. But what if I told you that scent could be quietly raising your blood pressure? Most bathroom cleaners and air fresheners are packed with VOCs, volatile organic compounds. These are chemicals that evaporate into the air. They're what give that clean smell, but they're also known to disrupt your cardiovascular system. Here's what happens. You spray the toilet, wipe down the sink, maybe plug in an air freshener, and while you're breathing in that flowery scent, your lungs absorb chemicals like formaldehyde, benzene, and phthalates. These chemicals trigger vessel constriction, nervous system stimulation, inflammation in the bloodstream. And that adds up to blood pressure spikes. Not just once, every time you clean, every time you breathe it in. In fact, studies have shown that regular exposure to household VOCs can increase the risk of hypertension by up to 21% in older adults. And if you already take BP medication, these chemicals can blunt your medicine's effects. Here's the good news. You don't have to stop cleaning, you just have to clean smarter. Look for labels that say fragrance-free or no artificial scent, plant-based, or non-toxic, low VOC certified. You can even make your own cleaner with white vinegar, baking soda, a few drops of real lemon juice, and skip the sprays altogether. Try a bowl of baking soda in the bathroom to absorb odor naturally. Because if your toilet smells like a flower shop, your lungs may be absorbing pressure-spiking VOCs. This is how we shift from illusion of clean to truly heart-healthy clean. And coming up next, we're entering more personal territory, something that happens when you glance in the mirror and feel a sudden wave of guilt. Let's talk about what I call bathroom mirror anxiety and why it might be quietly affecting your blood pressure. 6. Bathroom mirror anxiety. Blood pressure guilt. Let me ask you something deeply personal. Have you ever stared at your reflection and thought, I should be healthier by now? Maybe it's after taking your blood pressure. Maybe it's noticing your eyes look tired, or your skin's a little pale. Or maybe it's just a quiet voice inside saying, I let myself go. You're not alone. I've sat with hundreds of women over 60, strong, wise, resilient women who've whispered those same words to me. But here's what I tell them. That mirror isn't judging you, it's reflecting a story still in progress. Though the bathroom mirror is often where shame shows up first. It's where you check your blood pressure and feel discouraged. It's where you see the extra pounds and sigh. It's where you remind yourself of the meds you forgot or the walk you skipped. Next to this emotional stress, this quiet daily guilt can elevate your blood pressure just like salt or poor sleep, because your nervous system listens to your thoughts. When you criticize yourself, your body tenses, your heart rate rises, your vessels constrict. That's not weakness, that's biology. But now let's reframe. Instead of shame, what if the mirror became a place of dignity? A quiet moment where you say, I'm still here. I've lived through so much. And I'm still choosing to care for myself. One habit, one breath, one better day at a time. Here's something I ask my patients to try. Every morning after using the toilet, stand in front of the mirror, put your hand gently over your heart, and say, I'm not behind, I'm building health today. That one shift can lower stress, ease pressure, and rebuild hope. Because you don't need to be perfect, you just need to be kind to the person in the reflection. Now, let's look at something most women don't even connect to blood pressure. What happens before or after your bathroom trip when you skip water? 7. Ignoring thirst before or after toilet trips. Here's something I see all the time with my older patients. They tell me they avoid drinking too much water during the day. Why? because they don't want to make frequent trips to the bathroom. It makes sense, right? The more you drink, the more you go. But here's where most people go wrong. That habit of drinking less to avoid bathroom trips, it's actually raising your blood pressure over time. You think that cutting back on water will reduce bathroom trips and in turn lower your blood pressure? But that's not the case. When you don't drink enough water, especially before or after a bathroom visit, your blood volume decreases. That makes your heart work harder to pump blood through your system. And guess what happens next? Your blood pressure rises because your body is trying to compensate for the lack of fluid. Dehydration is often a silent culprit in high blood pressure. It can lead to increased heart rate, reduced kidney function, greater strain on your arteries and veins. In fact, a study by the National Institute of Health found that seniors with chronic dehydration often have higher blood pressure, making it more difficult to control hypertension. So here's the healthy twist. Drink more water, not less. But here's how to do it the right way. Sip water before or after using the toilet. It keeps your blood volume balanced. Drink small amounts consistently throughout the day. Don't try to drink it all at once. Infuse water with natural flavors, like lemon or cucumber, to make it tastier and more inviting. When you stay hydrated, you help your heart pump more efficiently, reduce stress on your blood vessels, and lower your blood pressure naturally. Remember, less water doesn't lower pressure. It's hydration that keeps you healthy and balanced. Now, this next habit might be surprising, but it's something you do every single morning. Do you head straight to the toilet right after you wake up? 8. Using the toilet immediately after waking. Let's talk about first thing in the morning. The alarm goes off, you roll out of bed, and you head straight to the bathroom because, well, nature calls. But here's the thing. Right after waking up, your blood pressure is already at its highest. That's just part of your body's natural circadian rhythm, the internal clock that wakes you up and gets your organs ready for the day. Circadian timing reveals. When you first wake up, your body releases stress hormones like cortisol and adrenaline to help you get moving. This rush of hormones makes your heart beat faster and your blood pressure naturally rise. Now here's where things get tricky. When you head straight to the toilet and push your bladder, you're asking your already elevated blood pressure to go even higher. Daily routine flip. It's a bit like starting a race before you've even stretched. You're forcing your body to jump into action when it's still adjusting to the day's rhythm. This sudden movement, especially if you've been lying down for several hours, can cause an even sharper spike in blood pressure. The best strategy? Wait a few minutes after you wake up. Stretch your arms and legs gently. Drink a glass of water. Let your body adjust to the day before you rush into action. Think of it this way. Your blood pressure needs a moment to wake up too. Don't surprise it with a rush to the toilet right after you get up. This small habit change could be one of the easiest, most effective ways to lower your risk of morning blood pressure spikes. I want you to feel empowered. Because blood pressure isn't just about the numbers on the monitor. It's about your daily choices. And those choices, they add up every single day. Conclusion. As we come to the end of this video, let's pause for a moment. I've shared a lot with you today, things you may have never even thought about before. But here's the truth. You're not alone in this. I've seen these habits play out time and time again with my patients. And trust me, you have the power to make a difference. Every little choice you make today, whether it's taking a moment to breathe before standing or swapping out that harsh cleaner for something natural, adds up. It's not about perfection. It's about progress. And as we age, every step we take towards better health is one we should be proud of. You know, when I look back at my 38 years in geriatrics, I've witnessed countless stories of resilience. I've seen people bounce back from health scares, change lifelong habits, and find new strength in their 70s, 80s, and even 90s. That's the beauty of our journey. We're never too old to start taking control of our health. So I want to hear from you now. Which of these bathroom habits surprised you the most? And what little change will you make today to protect your health and your blood pressure? Please leave a comment below. I'm genuinely interested in hearing your thoughts. And if you found this helpful, don't forget to hit that like button and share this video with a friend or family member who might benefit. Let's continue this journey together with awareness, compassion, and a healthy dose of dignity. Thank you for watching. I'm Dr. John Maxwell, wishing you all the best on your health journey.